All right, let's talk about the modern clinical roadmap for HIV. You know, what was once a journey filled with fear has completely transformed into one of hope and management. So we're going to walk through the clear, life-affirming steps that really define what HIV care looks like today.
I mean, just look at this. It perfectly captures the two different worlds of HIV. On one side, you have the past, right? A diagnosis that felt like a death sentence, full of fear. But on the other side, that's today. It's a manageable chronic condition with a clear plan for a long, healthy life. That incredible shift is exactly what we're going to break down.
So, where does this new journey begin? Well, it all starts with step 1, diagnosis. And believe me, this is no longer some scary, ambiguous process. It's simply the first, most crucial step toward taking control of your health and getting on the right path.
Now, this right here is a revolutionary idea. Public health officials now recommend routine HIV screening for pretty much everyone, from age 13 to 64. And why is that so huge? Because it moves HIV testing out of the shadows and makes it a normal, standard part of healthcare. You know, just as routine as getting your blood pressure checked.
The process itself is incredibly reliable, and it's really just two simple steps. Think of it this way. Step 1 is a super-sensitive screening test. It casts a wide net, looking for any sign that your body is reacting to the virus. Now, if that test catches something, it doesn't mean you have HIV. It just means we move to step 2, a super precise test that looks for the virus's actual genetic fingerprint, its RNA. This two-step system is built for accuracy, so you get a clear, definitive answer. Okay, on to step 2. So once a diagnosis is confirmed, the next thing is to get a really clear picture of how the virus is affecting the body. You can think of this like taking a set of specific vital signs for HIV that tell doctors exactly what's going on.
And it really comes down to two key numbers. First is your CD4 count. Your CD4 cells are like the generals of your immune system's army. They call the shots. So a higher CD4 count means you've got a stronger army. Simple. The second number is the viral load. That's just a measure of how much HIV is in your blood. And for that one, obviously, lower is better. Together, these two numbers give a perfect snapshot of your health.
Which brings us to the absolute game changer in HIV care. Step 3, the power of antiretroviral therapy, or ART. This is the heart and soul of modern treatment, and it's all about powerfully suppressing the virus so the body can heal itself.
So what is ART exactly? Well, it's a combination of medicines that work together to stop HIV from making copies of itself. The main goal is really straightforward. Get the amount of virus in the blood so low that it becomes undetectable. When that happens, your immune system, that army of CD4 cells, finally gets the break it needs to rebuild and get strong again.
Now, the reason RAT is so incredibly effective is that it attacks the virus from all sides. It's not just one drug doing one thing. You've got different medicines in the combo doing different jobs. Some are like bodyguards, blocking the virus from even getting into your cells. Others jam the virus's internal copy machine so it can't reproduce, and some even stop it from hiding its genetic code inside your own DNA. It's this all-out assault that the virus just can't beat.
And this right here is probably one of the most revolutionary, most liberating facts in all of modern medicine. Undetectable equals untransmittable, or U equals U for short. What it means is that when ART gets a person's viral load down to undetectable levels, there is effectively zero risk, that's right, zero risk of sexually transmitting HIV to a partner. This single scientific fact has done more to dismantle stigma than almost anything else. It's a total game changer.
But, you know, modern care isn't just about the pills. Step 4 shows us that true long-term health is about supporting the whole person, not just fighting a virus. It's about a holistic approach to wellness.
Yeah, real success takes a whole team. It's about physical health with things like nutritional support and plans for activity. But it's also critically about mental health, getting the support to deal with the stress and stigma that can come with a diagnosis. And it's about your overall wellness, from help with quitting smoking to having a whole coordinated team of specialists all working together for you.
So when you put all of these pieces together, from the diagnosis and the treatment to all of the holistic support, you really start to see the complete picture, a future that's not defined by illness, but by wellness. And this right here is the bottom line. This is the ultimate takeaway from this entire roadmap. With consistent ART, a person living with HIV can expect to live a life that is just as long and just as healthy as someone without the virus.
The science has truly turned a once-fatal disease into a manageable condition. It's incredible.
Which leaves us with one last, really important question. If the medicine is this good, what's stopping us from ending the epidemic for good? Well, the challenges today aren't purely scientific anymore. They're social. They're about making sure everyone has access to this care, focusing on prevention, and finally, dismantling the stigma that still surrounds HIV, a stigma that science, frankly, has already left in the dust. Thanks so much for joining me.